statistics and injuries. A common concern for older adult falls. 1 in 4 older adults reported a fall, 2014. More than 7 million of these falls require medical treatment or restricted activity for at least a day. More than 27,000 older adults died as a result of falls. That's 74 older adults every day. Fall death rates in the U.S. increased to 30% from 2007 to 2016 for older adults. If rates continue to rise, we can anticipate 7 fall deaths every hour by 2030.
One out of 5 falls causes a serious injury such as broken bones or a head injury. Each year, 3 million older people are treated in emergency departments for fall injuries. Over 800,000 patients a year are hospitalized because of a fall injury, most often because of a head injury or a hip fracture. Each year, at least 300,000 older people are hospitalized for hip fractures. More than 95% of hip fractures are caused by falling, usually by falling sideways. Falls are the most common causes of traumatic brain injuries.
Many falls do not cause injuries, but 1 out of 5 falls does cause a serious injury, such as a broken bone or a head injury. These injuries can make it hard for a person to get around, do everyday activities, or live on their own. Falls can cause broken bones like wrist, arm, ankle, and hip fractures. Falls can cause head injuries. These can be very serious, especially if the person is taking certain medicines like blood thinners. An older person who falls and hits their head should see their doctor right away to make sure they don't have a brain injury. Many people who fall, even if they're not injured, become afraid of falling. This fear may cause a person to cut down on their everyday activities. When a person is less active, they become weaker, and this increases their chances of falling.
Cost of falls. Treating fall injuries is very costly. In 2015, total medical costs for falls totaled more than $50 billion. Because in the U.S. population is aging, both the number of falls and the cost to treat fall injuries are likely to rise.
Fall injuries are among the 20 most expensive medical conditions. The average hospital cost for a fall injury is over $30,000. The cost of treating fall injuries goes up with age.
Medical costs include fees for hospital and nursing home care, doctors and other professional services, rehabilitation, community-based services, use of medical equipment, prescription drugs, and insurance processing.
Direct costs do not account for the long-term effects of these injuries, such as disability, dependence on others, lost time from work and household duties, and reduced quality of life.
Where are my glasses? Oh, there they are.
Hey guys, in the first clip, Mr. Bookman forgot to wear his glasses, which is a high risk chance for falling. Thank you.
Mr. Bookman, are you okay?
No.
Did you remember to take your medicine?
No.
The second clip, when Mr. Bookman was opening the oven, he forgot to take his medicine, which caused him to get dizzy.
Could balance and strength deficits cause this person to fall? Yes, it can. There are many reasons this person could have fallen, such as cardiovascular accident, neuropathy, diabetes, high blood pressure, and many, many more.
Slipping and falling in the bathroom is a common occurrence, but it does not have to be a danger zone. Keeping your bathroom safe is not only important for your physical well-being, but also important for your independence. One way to decrease falling in the bathroom is to make a simple adaptation to the toileting area by installing an elevated toilet seat. With this elevated toilet seat, we are able to increase the height of the toilet, making it easier for you to sit down and rise up.
Notice the environment within the bedroom seems very cluttered and narrow. Do you believe this could prevent or cause falls within the home? Would this environment be safe for someone who is at risk of falling? As you can see, cluttered furniture is shown to put a person more at risk of falling due to running into things. Also, space would be needed when maneuvering using a walker. Objects on the floor such as rugs, clothes, etc. can also be a hazard to falls. To prevent falls within the bedroom environment, every object and feature needs to be taken into consideration.
The client and the therapist have collaborated to make the home a safer place. This client is taking safety precautions by removing objects that would cause hazards.
Occupational therapy interventions to increase strength and balance. Functional tasks to improve standing balance. Exercises such as back leg races, where you're holding the bar, taking one leg back at a time, and hold for 1 second. Other exercises such as rock the boat, feet hip width apart, and rock weight from left to right foot, lifting foot off the ground, but holding on to the bar for support. Occupational therapy interventions also include providing the client with education on proper body mechanics, giving home exercise programs also.